As a psychotherapist and therapy patient, I've experienced many different styles of therapy for depression. Today, we're ranking them from best to worst, and the results may surprise you. I'll also reveal the 2 styles of therapy which are absolutely S tier for depression, and one therapy which could alleviate depression in just one session. Let's start off with one of the most prescribed and common styles of therapy out there: Cognitive Behavioural Therapy, or CBT for short. CBT works on the theory that our thoughts and behaviour affect our emotions, and it's one of the most widely practiced therapies by psychologists and therapists today. When we're depressed, we can experience distorted ways of thinking, and part of CBT is identifying those distortions and challenging them with logic and questions. Now, CBT is one of the most well-researched therapies, with some experts going as far to call it the gold standard of therapy because of the mountain of research suggesting how effective it is. However, CBT is very left-brained and logical, and that's not always a good thing. And when we are very emotional, we can start to become less logical, but emotion tends to overpower logical thought, and sometimes fighting strong emotions with logic is like bringing a blade to a shootout. A lot of research does show it can be effective for treating depression, but the research can sometimes be flawed. There are some good tools in CBT though, like constructive worrying, where you sit down for say 10 to 15 minutes and write down what's worrying you, and then ask questions like, what will you do if the worst does actually happen? This may be useful for depression, as it often comes with lots of stress and anxiety behind the scenes, and this tool may help to reduce some of that worry. But overall, CBT gets a grade C from me. Not the best, but also not the worst. However, big disclaimer, please do not stop or change any treatment without discussing with your doctor or therapist first. Now, if you've ever imagined therapy as lying on a sofa, crying about your childhood for months or years, this next style is exactly that. But my grade for this approach to treating depression might shock you. Psychodynamic and psychoanalytic is often very fast-focused, and it can involve a lot of crying. And this is the style of therapy which is viewed as more traditional therapy, the one where you talk a lot about your childhood and unpack all of the things that happened. Now, this is one of the styles of therapy that can take a long time, and we're looking at anywhere from 6 months to possibly even years. For this reason, it's not typically recommended by NHS and insurers as a primary psychological treatment for things like depression, because it takes much longer and thus is more expensive. However, some experts say that this psychotherapy can go deeper than CBT, and while it does take longer, research suggests that the effects are longer lasting than CBT. Now, personally, I have found this kind of psychotherapy to be quite cathartic when I've had it for myself. However, as far as depression treatment goes, I think it's not that great, because depressed people can be overly inward focused and already feeling terrible, and then a therapist is asking them to not only focus inwards even more, but to also go over all of the bad childhood experiences, and that's likely going to make people feel worse. Now, that's not really what you want when you've got someone who's probably feeling the worst that they've ever felt in their life with depression. So for me, as far as treatment for depression goes, this therapy gets a grade F. Now, if the idea of endlessly digging through your past feels exhausting, this next approach flips that on its head, and it could even cure depression, potentially in a single session. Human Given Psychotherapy is a solution-focused brief therapy, which means it focuses on solving problems and getting results quickly. The basic idea underpinning Human Givens is that we all have key emotional needs, things like meaning and purpose, community, security, and connection. When those needs are not met in balance, we can become mentally unwell. According to Human Givens Institute, depression isn't seen as a lifelong disease, but as a reversible state. It's what happens when emotional needs aren't being met and the person is exhausted from too much emotional worry and also having too much dream sleep at night. So therapy focuses on calming the brain and getting those needs met in practical ways. Human Givens also uses positive future visualization. In simple terms, that means guiding someone to imagine a more realistic, hopeful future, which can snap them out of the trance of depression, which is where the brain is stuck watching a sad film of the future where everything feels hopeless. The deep relaxation and positive future visualization can be powerful tools, and recent research from 2025 suggests human givens can achieve similar reductions in depression scores in about half the number of sessions. And I've heard stories from colleagues and trainers about how depression was lifted very, very quickly for their clients, sometimes even in a single session. From my own clinical experience, human givens can be quite a practical therapy, and it can work well for people who don't want to be in therapy for years or dissect their childhood. But it isn't a magic wand, and it doesn't help everyone. So for me, it's a bit of hit and miss depending on the person. In any case, human givens psychotherapy gets a grade A for treating depression. But what if, instead of doing techniques and visualizations, your therapist lets you do more of the talking? This next therapy has a bit of a mixed reputation. Person-centered counselling is where basically therapists actively listen to you with unconditional love and acceptance, and they might validate or reflect back what you're saying. Rather than telling you what to do or to think, the idea of person-centered therapy is that you have all the answers within you. You just need to be given the time and the space to figure it out. So personally, I do use this a little bit in my sessions, perhaps at the start of a session with a client, because I want them to feel seen and heard, and they might need to just vent a bit. This style could also work well for bereavement, where perhaps people need to just grieve, to process, to cry, and to just be heard. This style is also potentially used by some crisis support lines, such as Samaritans, where you have trained volunteers who are just listening. And sometimes that honestly is enough to just help people to calm down again. Sometimes people just need to be heard. However, the thing I don't like about this approach is that it can be quite passive compared to other therapy styles. I know I've certainly had clients complain about previous therapists because they just sat there and listened, and most likely they were a person-centered therapist. I also don't know how deep this work goes. The other risk is when a therapist only uses this approach, they could perhaps be setting the client up to be really dependent on them. I mean, what other skills and tools does a client develop to use outside of sessions? There's also the risk that the client doesn't get any better, and every week they just keep coming back and venting and complaining about the same things without actually ever moving forward. And this personally has happened to me when I tried a pure person-centered approach with a client before. I think this therapy certainly does have its place, but I'm not convinced that it's necessarily the best either for depression on its own. So overall, this approach gets a grade C because I think it can be useful in some crisis situations, which can happen with severe cases of depression, but it doesn't get a higher grade because of the dependency risk, the lack of self-help skills, and a lack of treating root causes of depression. If simply being heard isn't enough, then the good news is that this next approach is a bit more active and, dare I say, even fun. Internal Family Systems Therapy, also known as IFS. IFS works on the theory that our mind is made up of internal parts which have their own personalities, a bit like that Disney film Inside Out. So you might have an angry part, a perfectionistic part, a depressed part, and so on. And the idea of IFS therapy is to build a loving and unconditional relationship with all of these different internal parts, and to have a conversation with them, perhaps as if you were a parent with lots of inner children. Sometimes these parts are in the driver's seat in our mind, and we may need to gently ask them to step aside so that we, the calm, loving and rational adult, can take the wheel. Now recently, I did actually have a bout of depression myself, and yes, even therapists can get depressed. And IFS really helped me. I was feeling really angry about some needy and reactive behaviors I did, which made me lose a friendship. I was feeling really unlovable and worthless. And then what really started to shift things was when I connected with that needy and reactive part of me, and I got curious about it, and it showed me a bunch of past memories about what this part had experienced and been through. And then, as per IFS protocol, I actively tried to show it just a small amount of compassion, and suddenly I was no longer feeling angry at myself or feeling worthless. It made sense to me that I had this needy and reactive part, and I just felt so much love towards it. And that's when everything started to change for me. So sometimes IFS can involve tears, especially when you do what's called an IFS unburdening process, where you heal the emotional burden a part is carrying. But sometimes these are cathartic tears, and it can just make you feel a bit lighter afterwards. IFS doesn't have to involve looking at all of your childhood trauma, and an IFS therapist will always follow your lead and will not try to push or coerce you into doing anything you don't want to do or talk about. On top of that, there is promising research behind IFS effectiveness, and this idea of developing self-compassion is excellent for building genuine self-esteem, because people with depression can often have very low self-esteem. So for me, IFS is a grade A therapy for depression. One of these next therapies has been hailed as a gold standard. However, I think it's quite controversial and unethical. Dialectical Behavioural Therapy, DBT, and Acceptance and Commitment Therapy, ACT, and Mindfulness-Based Cognitive Therapy, MBCT, are what we call third-wave therapies, which are an evolution from regular CBT. These incorporate some kind of mindfulness and detachment, and start from the idea that we don't have to get rid of difficult thoughts and feelings to live a good life. Instead, we can notice them, give space to them, and perhaps just observe them and let them be. And then maybe we can choose how to respond. In theory, these therapies tend to balance acceptance of your thoughts and emotions with learning concrete skills to manage crises, regulate feelings, and handle emotions. I think there is use in radical acceptance, as it's taught in DBT and ACT, and sometimes acceptance of yourself and others is what's needed to bring you peace. And likewise, I think mindfulness and detachment can also be useful tools at times. However, what I don't like about some of these approaches is that they focus heavily on coping skills rather than the treatment of root causes of depression. Now, what's deeply concerning is there has been some research reporting on harmful effects that some people have experienced from DBT therapists. It's also a bit alarming that even the founder of DBT has admitted that DBT gets called blackmail therapy because the therapist is allowed to punish the client by temporarily withdrawing support if the client does certain things, like maybe they try to injure or unalive themselves. This seems pretty unethical to me, especially because as therapists, we're meant to give clients unconditional acceptance and love. So for me, ACT and MCBT, they get a grade D for depression treatment, but DBT gets an F because of the ethics factor. Now, this next therapy might involve some strange experiential exercises, but they might just work. Gestalt therapy focuses a lot on what you're feeling right now in your body, in your emotions, in your reactions. You might do little experiments like role plays, or perhaps even talking to an empty chair, or maybe writing a letter and reading it out loud to express things that you've been holding in and to perhaps give yourself the closure you needed but never got. I've previously used the Gestalt empty chair technique with my own clients, and I've personally found it to be quite powerful to have the client have imaginary conversations with people from their past by literally talking to that empty chair. I also have used Gestalt letter writing for myself when I've needed to perhaps express something which I never got the chance to. Now, there isn't loads of research on Gestalt's effectiveness, not as much as CBT, but there are some studies suggesting that it can work well, including for depression. Thus, for me, Gestalt gets a grade C for depression treatment. I think it can help. However, I'm also not convinced it may fully treat the root cause of depression. But instead of talking to empty chairs, what if you could heal and get better just by moving your eyes in a very specific way? Eye movement, desensitization, and reprocessing, also known as EMDR. So EMDR is an interesting one, and this involves basically following a light or your therapist's fingers left to right rapidly whilst you focus on something like a painful memory or an emotion. The idea is that making your eyes move in this way replicates how your eyes move when you dream, and this forces your brain to reprocess whatever is bothering you. Traditionally, EMDR is used to treat post-traumatic stress disorder, known as PTSD. A large recent study out of Korea suggests that EMDR might have a significant effect on depression too, not just trauma. Now, I'm not trained in EMDR yet, so I haven't used it with my clients. However, I've personally had a lot of EMDR before for myself for trauma and PTSD many years ago. And while EMDR did make me cry a lot, I also felt that it really helped shift things for me and helped me to get rid of some pretty bad disassociation I was experiencing. So if you have trauma and PTSD as well as depression, I think this may be a great therapy to try. It's actually a recommended primary treatment by the NHS in the UK for PTSD. However, I'm going to give this one a grade C for depression, specifically as I think the research is potentially promising, but EMDR can be quite triggering for some people. Like, for example, one of my clients has said to me before that EMDR would just leave them feeling a bit destabilized afterwards. Now, the next therapy is even stranger because it's not really a talking therapy at all. In fact, you don't actually have to say anything for it to work, but it could be really ideal for depression. Hypnotherapy can work well with depression because it can involve deep relaxation and positive future visualization. As mentioned earlier, these can be very good things to do for depression. One good thing about hypnotherapy is that clients do not need to talk. They just need to kick back, relax, and listen. And this can be great for depression too, potentially, because honestly, people who are really depressed, they're exhausted. They're usually not sleeping well, they have low motivation and energy. There is research to support that hypnotherapy can improve sleep quality as well as alleviate depression. So overall, I give hypnotherapy a B grade. I've certainly used some hypnotherapy techniques with some of my own clients, and I would say that it can really help, but it needs to do more to address emotional needs. And some people may also need to just vent and process a bit verbally, which is not really part of hypnotherapy. Now at this point, you might be thinking, okay, but do I really have to pick just one of these? And well, there is actually another style of psychotherapy I haven't mentioned so far, which I think is absolutely S tier for depression. Integrative psychotherapy. Rather than rigidly trying to stick to a single style of therapy, what if there was a way to use a bit of everything and to tailor and adapt it to the client? Well, that is exactly what we call integrative psychotherapy. And it's awesome. In fact, some of us psychotherapists have a saying that rather than trying to force the client to fit the model, instead make the model fit the client. Integrative psychotherapy allows for that flexibility and that tailoring to the client. And as per the IFS therapy style mentioned earlier, we all have parts, and some of these parts might respond really well to one type of therapy, and likewise, we may have parts that just really hate a certain style of therapy. We may also need different approaches at different times, depending on our emotional state, our character, and our temperament. But there's one more S-tier psychotherapy that goes even further. And it doesn't just help you heal, it also helps you to rebuild and improve your life. Therapeutic coaching combines psychotherapy and coaching into a unified approach, such as with the fusion model. Now, there are other models out there, and this is quite a new approach. It does need further research, but having used this modality personally, I have seen some really powerful results, and so has my clinical supervisor. For example, there was one clinical case where a female client had been severely depressed, and they'd even been in a psychiatric hospital, and they'd already tried to, pull the plug. But after working with me for several months, their depression had lifted and they were able to go back to work and to do things they enjoyed again. Quite remarkable results, really. Therapeutic coaching has also been officially recognized by the British Association for Counselling and Psychotherapy, which is one of the largest and most respected professional bodies in the UK. Sometimes we need space to heal, to vent, to cry, and to process, which is the psychotherapy side. And sometimes we need something practical, something to help meet our needs, help us make positive changes and work towards our goals. And this is the coaching side. And what therapeutic coaching does is it brings all of these together to bring you the best of both worlds. So here's a quick recap of my personal rankings for depression. I just quickly want to say that if you feel any of these therapies are really helping you, then by all means, please do continue with them. But if they're making you feel worse, then please consider discussing this with your doctor or therapist before stopping or changing treatment. Now, I'm curious, have you had any positive or negative experiences with any of these therapies I've mentioned? Or have I perhaps missed a major therapy out that you found to be a game changer for your mental health or depression? Please let me know in the comments below. I'd really love to know. Speaking of depression, did you know that there are at least 5 hidden symptoms which most people miss? Click this video here to learn what they are, and I'll see you there. And remember, this video is not a replacement for psychiatric or medical advice.